So thank you for explaining that. Doctor, I want to get straight into cancer. Okay, do you believe that most cancers, I mean, now when we look at data today, 95 to 96% of cancers are lifestyle, the balance 5 to 6 highly genetic, maybe may not be prevented. I personally believe, seeing so many cancer patients, that a lot of them can be prevented. I would love for your thoughts and experience on cancer, and if you believe it can be prevented, what can we do and what are we not doing today that's bringing on so many endometrial?
For a woman, a majority of her cancers come from 4 parts of her body. For the modern woman, breast cancer has taken number one spot. Till recently in our country, it was at number 2 or 3. It's come to number 1. More so in our urban population, which for good or bad tries to mimic everything the West does.
Yeah.
This is followed, and it used to be followed by cervical cancer, which has kind of dropped to number 4, but in our country still remains at 2 or 3. Endometrial cancer is coming up really fast. And then you've got ovarian cancer, which is the one that we have the biggest problem with because ovaries are so difficult to access and evaluate. So let's take breast cancer first. Breast cancer is something that started happening in a big way when we changed. And we spoke earlier about women not menstruating that much 100 years ago. Pregnancies protected women from breast cancer. Lactation protected women from breast cancer. So for a woman who has not lactated many times or not lactated at all, her risk goes up a little bit. Please understand that when you talk about medicine, you talk about evidence and statistics, and we don't want to create a fear. You don't have to lactate to prevent cancer because a lot of my patients who have cancer have children, but maybe they have 1 or 2 children. So there is always a family history, but the family history is responsible for about 15%. So everyone, oh my God, I've got a history of cancer in my family. Well, yes, but it would have to be a first degree relative, a mother or a sister or a daughter. And if it's a little further, but it's always nice to know your family's history, to talk to your mother, to talk to your aunts, because if you have a family tree, which is showing me multiple cases of breast cancer or ovarian cancer, you need to be vigilant. And since we are on this, you could do a genetic test, you could do a BRCA test, and if you are positive, then everyone knows about Angelina Jolie and what she did. And you do whatever needs to be done for you. You don't have to follow the same.
True. Yeah.
Interestingly, everyone had an opinion on what she did.
Yeah.
And the funny thing is, it was her breast. She lost her mother. It was her decision. And the most amazing thing is when the most beautiful woman in the world can do it and still look great, women stop feeling stigmatized and embarrassed if you have to undergo surgery for breast cancer. Other ways of preventing breast cancer, endocrine disruptors. Estrogen in the environment, estrogen in what you're having. Is it because a lot of breast cancer is hormonally driven, and you very rightly said there could be estrogen receptors positive, there could be progesterone receptors positive, and you could have it. Can we prevent breast cancer? If we completely changed our life, but that might not be easy. But what you can definitely do is you can pick it up at the earliest stages. If you're a woman, you have a responsibility to do a self-breast examination. It's something you can do very easily once a month. You can't give yourself 5 or 10 minutes. And I can tell you it's a lifesaver because I've had patients picking up things themselves. A periodic examination with whoever your healthcare provider is. It could be your GP, it could be your gynecologist. I'll tell you what I do in my practice because there's a lot of confusion regarding mammograms. I normally would prefer my first mammogram somewhere when the woman is around 40. This is a woman who doesn't have family history. That woman might start earlier. And then if it's completely normal, the next might be after 2 or 3 years or 4 years. After 45, today the recommendation pretty much is do it annually. A mammogram picks up something before you can feel it. And it's usually also combined with ultrasound. Now, women dread mammograms because they are painful. Well, yes and no. Today, the machines are much better. And, a little bit of pain to save a life, I think it's something worth doing for yourself. So if you do that and you pick up something earlier, don't hide it. My biggest problem is sometimes a woman feels something and she's so afraid that it might be something bad, she'll just not talk about it and she'll wait for it to go away. And I've always said, women, if the man had something, the woman in his life would rush him to a doctor that same evening.
Yeah.
When women have something, they'll procrastinate, which is why very often women come late when it is their problems. Coming to cervical cancer, the only preventable cancer really is cervical cancer. You can prevent it. I'm not talking about picking it up early. And we've been able to prevent cervical cancer for the last 60 or 70 years. A simple pap smear, which is a simple pickup or scraping of cells from the cervix, a small little internal examination, can pick up the cancer before it becomes a cancer. Because it goes through a series of precancerous changes to reach cancer. Just imagine, it's a disease continuum. If I can find it somewhere during the journey, I can stop it and stop it from reaching cancer. And then the Nobel Prize was awarded for the discovery that a virus caused cervical cancer, the HPV virus. So now I have a test for HPV. There are 100 plus different strains of HPV, of which about 9 or 10 are considered high risk. And those are the ones that cause cancer. Now that we know that there is an HPV infection, I can do a smear, find out if she has HPV. And today, I do an HPV pap smears for every woman who comes to me. Everyone. I always am proud that we are a 100% HPV pap clinic. If she is normal, she doesn't need to do it each year. She can do it after 5 years. But if she is abnormal, she goes under vigilance. No panic. Even if you are HPV positive, less than 2 or 3% will move towards cervical cancer. And then there's the vaccine. We today have a vaccine, which initially was 2 strains, 16 and 18 are responsible for 80%. But today we have a 9-strain vaccine, which is far superior. And this is a vaccine which can prevent HPV infection. And if I prevent HPV infection, I prevent precancer. And if I prevent precancer, I prevent cancer. Look at the opportunity. It's approved for use from the age of 11 to the age of 45. The earlier you give it, the better the girl responds. But never mind if you haven't taken it early, you can still do a catch-up later on. Thankfully, a lot of pediatricians are doing it today. And the advantage of doing it before the age of 15 for your daughter is that when you give her this vaccine now, the WHO says 1 dose is enough. And after the age of 15, though the recommendation still remains 3 doses, the WHO says 2 doses are enough. And I've completely shifted to the 9-strain vaccine, though the 4-strain vaccine is still very much there. It's more affordable. And I believe our government is going to launch it in a big way, and they will take the 4-strain vaccine, which will cover 80%. Now comes the question, and my patients were like, very often, you're telling me to give a vaccine to my daughter. What about my son?
Right.
Tough one. But Australia started doing it for the boys as well as girls a long time ago. Some Western countries are doing it for both. Now, the reason why it is focused on girls is because girls have this problem with cervical cancer. But remember, we talked about oral cancer before. HPV, you can actually prevent this with the vaccine as well.
So it's protective for guys as well. It's protective for boys.
And if I might be a little this out there, because I'm very pro women and favor women. That's where women get the HPV infections from. So let's get it at the source. The problem is cost, and once there is an expense, you've got to focus your expense on the one who needs it more of the two. And of course, the second is production and the amount that's available. If you suddenly started diverting the limited amount of HPV vaccine you have to both, then you might suddenly find shortages for the girls. But we've got to work this out. And I look to a utopian world where, like all the other vaccines, which are gender neutral, the HPV vaccine should be gender neutral as well. Everyone should get it.
Right.
If they haven't got it when they were in their adolescence, they can still take it. And while it's approved till 45 and a woman has every right to take it till 45, I personally, and this is only a personal opinion, feel that after the age of 35 close to 40, I don't think she will get the same benefit. And as long as she's being safe with sex, as long as she's doing her pap smears regularly, she can still prevent cervical cancer.
Is the age limit the same for the guys?
So what happens with this vaccine is it's a lot more effective when it's given to younger populations.
Got it.
and
For
it's
both
less
genders.
effective later. So your immunological response later is not going to be as good.
Right.
So now it's been around for long enough. We did this first when we didn't have the vaccine for 5 or 10 years. Today we've had the vaccine for the last 25 years. There's no excuse for someone to not to get it early enough. In our practice, very often again, I catch my patient if she's come to me with the pregnancy 6 months post-delivery. So by which time she's generally in a stable relationship, everything is fine, but you still want to be safe. Then we come to uterine cancer.
Yeah.
It's just coming up in a very big
Yeah.
way. And look, a lot of it is the issues that you deal with. Okay, PCOS, hormonal disturbances, excess estrogens which are not balanced off by progesterone. So those anovular cycles where she's not releasing an egg, where she's not ovulating, and 2 months, 3 months, 4 months before she gets her next period, the endometrium tends to overgrow, and an overgrown endometrium can sometimes have changes which start off as precancerous and might develop into cancer. So PCOS have a higher incidence of uterine cancer or endometrial cancer if they are not taken care of. Endocrine disruptors, estrogens in our diet and environment do it. Obesity, higher risk. So we actually have a triad of obesity, hypertension and diabetes who have a higher risk of endometrial cancer. To detect endometrial cancer, we have to be vigilant. Any abnormal bleeding after menopause is unacceptable. Whether it's bleeding or spotting, a menopausal woman shouldn't be having postmenopausal bleeding. Every woman after a certain age should get an annual ultrasound, just as I spoke about the mammogram.
Yeah.
If the lining of a uterus is more than 5 millimeters, she needs to be investigated. No panic, investigation. Most cases, 95% will be normal, 5% may be abnormal, they need to be dealt with. And endometrial or uterine cancer can be prevented by the contraceptives we discussed earlier, particularly the progesterone containing or bearing contraceptives. And the intrauterine device that releases progesterone can actually reduce the risk or prevent endometrial cancer. So again, you've got, even if you have the risk factors, if you do these things, and before we started this chat, you spoke to me about the fact that someone spoke to you once about doing hysterectomies to prevent this. I mean, that's ridiculous. It's an overkill. I don't think any person, man or woman, should lose a part of their body if they don't have to. Isn't vigilance better? Isn't contraception better? In fact, you've got a minimally invasive procedure where I can put in a telescope, remove the lining of the uterus down to the basal layer and put in it's a daycare. Isn't that better to talk about removing a uterus? And I feel nothing is more hurtful and insulting than telling someone, you don't need this organ anymore, let's get rid of it.
Doctor, what I see is a lot of people come and say that, hey, Luke, I was told that you had your kids. Are you going to have any more kids? No, just remove the whole thing.
Let's ask the husband the same question and ask him whether he needs his testicles anymore. I mean, it's crazy. You don't do surgeries because you don't need an organ anymore. We've never needed the appendix in our bodies. And once in a while, it's going to bother us. We don't go around taking everyone's appendix off. So women, be aware, be careful, be vigilant. Have a program for yourself. Men, if you are listening here, take responsibility. She looks after your health. She makes sure that you get your annuals. Make sure that she gets her annuals. And how about celebrating her birthday month by taking her for her annual checkup after her birthday, not before, in the following month. We don't want any bad reports in the month before her birthday. And just make it a part of your life. This is what you're doing for her. Finally comes ovarian cancer. Now that's the tough one. And I say it's the tough one because, first of all, the ovaries can manifest a variety of cancers. The uterus has endometrium, so it's usually an adenocarcinoma, which is a certain kind of cancer. The cervix has squamous epithelium, so it's a squamous cell cancer. Cervix responds better to radiation, uterus responds better to chemotherapy. But when it comes to the ovary is everything. The ovary is what gives us eggs and babies. So the ovary can have epithelial cancer, it can have stromal cancer, it can have germ cell cancer, all kinds of cancers. The problem with ovarian cancer is it's sitting right there, and the moment it spreads everywhere.
Right.
Endometrium gets held, breasts can be palpated, the cervix, a pap smear can take care of. It's very difficult to access ovaries. So for ovaries, one is we need vigilance, and we need vigilance by any changes in habits. I mean, people have often read about if you have any changes in your bowel movements, if you have any sudden distension, if you have a loss of weight, get it investigated. Periodic ultrasound, you might pick it up early. There are certain tumor markers which I know get done annually, but they have never been really reliable for ovarian cancer. Can we prevent ovarian cancer? To some extent, you can. Firstly, if there's a family history, more vigilance. If you're BRCA positive, more vigilance. And maybe that's the only time I would say you may want to act upon it. If I've had a patient with a very strong family history and she's come and she says, doc, and she's been advised, get these ovaries out, that might be safer for her after a certain age. And something very, very interesting came up. A lot of women are used for their hygiene, use a lot of talcum powder. And there's a case in the US which has been settled against the pharmaceutical company, which was one of the largest manufacturers of talcum powder, because they never told women that there was research to show that if those particles of talcum powder get into the body, they can get to the ovaries and cause an increased incidence of ovarian cancer. So when it comes to hygiene, of course you have to be hygienic. Try and be as natural as possible, but avoid this obsession with sprinkling talcum powder all over your body, particularly around your genitals.